to A Shot of Facts. This is your girl Deja Renee, and this episode is a shot of Melanin and Medicine with Dr. Omolara Thomas Uwemedimo. Now, Dr. Uwemedimo is a board certified pediatrician for over 15 years and an academic faculty member for over a decade, in which she mentored women physicians of color. Now, she is also the CEO and founder of Melanin and Medicine, which is a company designed to provide Black women physicians with support through an online community of networking, masterclasses, events, and coaching, and also podcasting. So, Dr. Uwemedimo, how are you doing today?
I'm doing well. Thank you so much. I'm excited to be on the podcast.
No, it's a pleasure to have you as a physician on the show. This is my first time having a doctor on the show. So I'm so happy to have you here because I have a lot of questions.
Well, I get that a lot. So once you mention you're a doctor.
Yes, because my first comment is that as a woman, a Black woman, I always try so hard to find a Black physician or OBGYN, and I'm in Virginia right now, and it's somewhat difficult, I'm finding, to find a Black woman physician. Why do you think that?
Well, because it's difficult to find a Black woman physician. So basically, only 2% of physicians in this country are Black women. And so that is probably part of the process, part of the reason. I think, and there's multiple reasons for that. I like to say there's a pipeline that people talk about, but it's extremely leaky. So in terms of Black women being pushed into medicine and having the ability to be mentored to be able to go into medicine, that there's one leak around that, whether that happens, and that's due to multiple social issues, and whether that be income and poverty and education access, and the amount of money it actually takes to become a physician, whether that be applying for loans or whether that be actually just being able to have the wherewithal to do the applications that are needed. But I think the other piece is, even during the process, even during medical school and undergrad, there were many women who, it can be just like many, I think, workplaces where there can be oppression, there can be trauma, there can be all of those things that are much more heightened for people of color, that it be, in addition to the added workload of what it takes, it can just be so oppressive that people leave. And then even as they actually have gotten to practicing as a physician, like myself, the covert and overt racism that happens from patients, providers, colleagues, can also take a toll. And you find a lot of us actually have moved out of academia and into other positions as well too, not only for that, but also wage discrimination, all of the things that we endure as Black women professionals. So, it is hard. I will say that there is an app called Health in Her Hue by a friend of mine, Ashley Wisdom, which is getting a lot of great praise because of the need, like you said. So that's one resource that I will lend to you and your listeners.
Definitely add that in the show notes for sure. And I'm going to use it myself too. That's a great app. And honestly, I didn't even think of the perspective of, I guess because I'm not a doctor, but the perspective of, women of color, Black women in medicine actually facing racism and discrimination. Because outside looking in, a lot of Black women who try to get, gynecologists and pediatricians, like Black women specifically, I feel like as patients, we always feel like our voice is minimized when it comes to having doctors that are not Black, essentially. So it's really interesting for you to bring your opinion and your perspective as someone that's in medicine. Like, I knew it was going to be like some discrimination, but I didn't think it was that deep. That's really sad, honestly.
Yeah, it is. And so what I like to say is the white coat doesn't protect us at all. And there was, I don't know if you and your listeners heard about Dr. Susan Moore, but this was a woman, a trained physician. She basically had to she created a Facebook post when she was admitted with COVID infection, and particularly because of the fact that her pain. She was denied pain treatment. She was also almost sent home, and she had to advocate for herself because she was so knowledgeable about the symptoms, had to advocate for getting the right imaging, where they did find, that she had florid COVID pneumonia. And even then, the energy that it took that to actually post and say, this is what's happening to me. And if I don't say this now, they're going to try to kill me. And she passed away about 3 weeks after because of the delays, because of, not getting the care. I think also because of just the sheer energy that it takes to have to fight for you. There's a sheer energy that it takes to fight COVID, to fight, you have to, but to then have to have two fights happening at once, trying to fight an illness and also fight for your, dignity and your ability as someone who is a provider, as someone who treated COVID patients. And so I think it was a clear example, and I think of her every day. We're doing a lot of advocacy around protecting Black patients and providers. And I do a lot of advocacy and think about her because of the fact that a lot of us as Black women straddle that line where we're patient and we endure the same things that you do, and then we're provider and we're trying to protect, we're trying to protect you guys while we deal with kind of the onslaught of people discounting us or dismissing us or disrespecting us.
That's absolutely ridiculous. No, I have not heard of that, but it needs to be known more, globally about that. That's ridiculous that she had to fight to get treated. Like, and that goes to my second question for you about how Black people have such a distrust in medicine industry. And I wanted to know, what is your opinion about how Black people have such a distrust? Like, even around COVID, for example, how, a lot of Black people were kind of against getting the vaccine for many reasons. And I'm not going to debate whether people are going to get it or not. I'm not going to debate that right now.
Don't do it.
Yeah. But I know it's a lot of people who have just a huge distrust towards the medical industry. And it kind of hinders Black people in some ways at some point, because they don't go to doctors to get checkups and things of that sort too, for preventative measures. So what is your opinion about the distrust that Black people have?
Yeah, I think that there's a huge, I don't think it's, I would say it's very valid. And I think the reason being is that most times Black patients are not getting informed. A lot of times they're going to physicians who aren't valuing their opinion, aren't participating and doing shared decision making, aren't sharing both the harms and the benefits, and allowing their patients to be able to make a decision, and are kind of sometimes, even for just time efficiency, are just kind of going through the motions and so a lot of times certain things get missed, certain information doesn't get disclosed. And it's not in terms of a maliciousness of the provider, but more so, I like to say medical racism continues because people are just being good doctors. And why I say that is because that's all they're doing, right? And fighting racism in any field or any sector requires active work. It requires having to say, you know what, I have to check this, or we have to, these are the decision makers for this patient. So we're going to go on the phone and we're going to talk to all of you and get all of those concerns. And that requires time and added work. And honestly, we can talk about the healthcare system and payments and all of that. And it's difficult for people to kind of wrap their head around, especially when a lot of times our issues can be a lot more complex because of the disproportionate prevalence of unmet social needs, whether that be housing insecurity, food insecurity, poverty, the fact that more Black and brown patients have those issues, right, in terms of when they're coming in. And not to say, right, the absolute number of highest amount of impoverished people in the US are white, but in terms of just making that clear, but in terms of when we see the complexity of how that intersects with their health, we see that more so in us because of the fact that there is difficult access to care. Not only difficult access to care, but when you get to care, you get the treatment like Susan Moore. And it makes you distrust because you feel like, does this person value me? Does this person even trust me? Does this person even respect me? And unless we start figuring out how to get more of our healthcare encounters to look like that, right? Look really centered around you as a human, not just patient-centered, but human-centered. That is going to be, I think, the linchpin, because I haven't had an issue with when I explain the facts to patients, and I'm a pediatrician, so I deal with a lot of vaccine, I have a lot of vaccine talks, right? And I haven't had that issue. I've had patients, but they know I love them. Even the patients who I tell them every day, every time you see me, I'm going to tell you about the vaccine, right? But they know that it's coming from a place of like, this person wants to hear me out. She's giving me all the information and I'm going to make this decision. And she respects me at least as a human, right, to say that, that's okay. And it's not judgment or casting you down. So I want to just share that I do feel that, that's important. People talk about this Tuskegee, but we don't have to go to Tuskegee to like see the issues that happen where children aren't being given pain medicine, children at the same rates as their white counterparts for same illnesses, where we see women, right, who are dying when they go into the hospital and they're dying at disproportionate rates when they're Black through childbirth versus whites. I would be very scared too. So yeah.
And that's one thing I also want to ask you too, because my last episode was with a holistic health coach, and we kind of had the conversation of basically how some of the tests and some of the standards are outdated and based off of systemic racism. Mm-hmm. So what do you think of that when it comes to like BMI scale and it's other, scales that they go by with race, like more than me, but I think that it's outdated and it's based off of racism. So what is your opinion about that?
I think that, the more right? Because I think even in med school, I was taught certain medicines for hypertension are better for Black people than for white people. Like I was taught that, right? And it's not and so there's a lot of unlearning that has to happen, but that's hard for physicians where they're like, no, I learned this.
Book. Yeah, I mean, and it's understandable.
Yeah. And so I think that, once again, it's going to be work to actively unlearn certain things that we were taught. Spirometry, which is something that we use to test like lung volumes and how well someone's breathing. It used to have a race measure basically to say that Black people's lung volumes are just inherently smaller than white people's. And so the small lung volumes, quote unquote, that we were saying, right, inherently now made the threshold much lower for threshold much higher for where somebody, if they were showing a low lung volume, that you wouldn't, if they were Black, you wouldn't like say, that's problematic. If they were white, you say, oh, that's problematic. Right. And that is an issue, or misdiagnosis of certain diseases, because those don't happen in Black people. Those happen and so what we have to do and what we're trying to do, I know a lot, not myself, but a lot of people are talking about decolonizing medicine and taking out certain words, how we present patients. 40-year-old Black woman, does it matter that she's Black? Honestly, does it? Not really, right? That doesn't really matter. So it literally is so endemic in each part of even how we present patients, how we diagnose patients, that's why it's active work. And I think it's going to take holistic partners and other partners who are very much about centering communities that have not been centered and partnering with them in this work to help.
And that's another question that I had from the previous episode is I always wonder because I'm a researcher type of person. Like, I went to Tuskegee myself and
Oh.
I got my bachelor's and master's in there. And so I'm always in the research mindset. And it always baffles me that a lot of these diseases are race prone. Like, Black people are more prone to getting this disease and that disease. And I always wonder, like, why? Like, why are we more prone to getting this disease? Like, and you can probably explain it more than me, but that's always something that I always wonder. Like, they have, information on why it might be higher in this race, like from our diets and things of that sort. But I'm like, okay, regardless of diet, like, why is this certain disease more higher in this race than another? That's something that always baffles me.
Yeah. So if we think about it, there are some words that I'm going to bring out, particularly weathering and allostatic load. But first, I'm going to talk about the fact that this came up, interestingly enough, during the pandemic, when I remember Dr. Fauci. I love Dr. Fauci, but Dr. Fauci had this statement that got me upset, where he was like, the COVID is potentially is much higher in Black and brown people because of those comorbidities that they have, and then just stopped. And I kind of was like, we didn't just get those comorbidities, right? When you think about things like asthma, a lot of times the predilection for asthma is because of the fact that there are multiple allergens and multiple issues in terms of mold and things like that in housing that is deprived, and that
environmental racism.
Environmental racism, pollution in our areas instead of in other areas, right? Food insecurity, and now those being food deserts, like we like to call them, where the accessibility to healthy food, not only if it's accessible, then it's higher priced in our communities. And so of course you're going to choose not those high priced vegetables, but something that I can afford. All of these, the lack of understanding that a lot of these issues are not issues around choice, but issues because there is no choice. And so one thing that you can say is that we call them social determinants of health. The idea is that what we do know is that only 20% of our health outcomes are actually due to clinical care and medicine. 80% are due to our environment, our behaviors, where we live. It's really due to all of these more global things, and particularly structural racism hits on all of it, right? Every part of our lives, in America in particular, is touched by racism and the structures. And even when you think about issues such as, racial trauma, right? There is an idea here, weathering, where because of the fact that we have these problematic places that we go for healthcare, and we don't go because we are treated horribly, there's a medical underservicing that happens for us. But then there is trauma, there is the stress that we feel going day in and day out, code switching, trying to make sure we don't get killed, all of those things. And it causes an actual inflammatory response, right? Where we call it the fight, flight, or freeze. But basically, imagine if you're where the tiger, right? And the tiger's chasing you, okay? You know what happens. Eyes dart, heart rate comes up, everything. You're ready to move. You're ready to, right? Now, imagine if that tiger, right, never stops. Like, the tiger goes away, everything is relaxed. Imagine if that tiger is chasing you every single day. And that tiger can look like me just going out for a walk and hoping nothing happens to me. Me going to work and just afraid if I speak up that somebody's gonna, my job is gonna, it literally doesn't stop. And so that causes a weathering. And what we know, at least from science, is that when you look at chromosomes, the ends of the chromosomes are telomeres. And those telomeres for Black women, when they looked at Black women and white women, our telomeres were shorter, shorter to the degree of an average of 7, that it looked like they were 7 years older than white women of the same age. So that means that basically this weathering is causing us to age faster, life expectancy issues, And that allostatic load, or that stress, that chronic stress, actually leads to dysregulation of our immune system. So we're more likely to get autoimmune disorders. I have an autoimmune disorder, actually. We're more likely to have higher blood pressure, cardiovascular dysregulation, and we're more likely to have metabolic dysregulation with, difficulty in terms of our insulin, or in terms of how we process our food, and basically, how we make sure that kind of our bodies, right, are going to hold more fat and all of those things. So I think it's just really important, and I'm glad you brought this question up, because this is not just we are Black, and diabetes, and that was just what we were blessed with because we're Black. No, it literally is our environment that is causing this, and that's a global issue as well, actually.
Yeah, they never want to explain all the underlying issues that we face as to why we're more prone to these diseases. Like, that really used to get under my skin so much. Oh,
well, because they'd have to do something about it, right? They'd have to deal with the reality that, oh, we have to fix these food deserts. Oh, we have to pay for better schools. Oh, we have to, and that's hard. Like, why don't we let's just treat the diabetes and call it a day?
Right. And speaking of environmental racism, because I had a previous episode too where I interviewed basically an environmental advocate, right? And well, he did more than that, but pertaining to environmental science, we talked about both of our experiences because I'm from Detroit, he's from Baltimore, and we both grew up experiencing environmental racism. That I realized from a young age that it's not normal for over 50% of my family having cancer or asthma. And for a lot of people, that's what we have normalized because that's what we grew up in. We don't know any better. And it took me actually going to college out of state to realize, wow, it's not normal to smell rotten eggs outside when you walk outside, because it smells like sulfur and gas, because I live by an oil refinery. And I realized that a lot of people that I grew up with have somebody in their family with cancer or asthma or autoimmune disease. And it's this is not just because we're Black, it's because of what we're breathing in, it's because of what we're eating. And so I'm glad that you mentioned that with a lot of these underlying diseases that are prone to us, it's because of racism overall.
It is. I mean, you can boil down the monologue that I said and just say racism, and you got it.
Which is mind-blowing. But what are ways that we can mitigate this from just a micro level? What can we do?
Yeah, so there are multiple, when we think about those multiple pieces of I call it medical racism, right? The first thing is that there are those structures, and those structures really are determined by our localities, by our states, and potentially by our federal government. And so there's a huge policy piece and advocacy piece. And I always say people try to think of the thing that angers you the most. That's the passion space, right? And not everyone needs to do everything, right? But just thinking about what is it that really is getting under your skin, and understanding that is going to have to be, in terms of structures, really going to have to come from the policies, and also from either creating new resources as well. So there's the dismantling and rebuilding of what is available, but also the idea of building anew. And so we think about green, we think about gardens, community gardens. We think about other ways that we can try to build in the resources that have been left out while those things are getting recreated, right? What are the ways that we can do that? And those are really important things that usually context matters, and working within your community is kind of the ideal way. I think the second level of this is healthcare access and utilization. And a lot of that comes from both education and building our social networks. And so that means that really identifying, and I think a lot of us as Black physicians really see ourselves as kind of these people who have to play these multiple, we can't just practice medicine. We can't. We have to be advocates for our community. We have to do this, we have to do that. And I think that it's really important about trying to think of what are the ways that we can improve access? And so is that insurance? How do we make sure that we are bringing more facilities closer into communities? One of my other hats is a CEO of Strong Children Wellness, which is actually a practice that we actually create medical services and put them into community-based organizations that sit in communities, so that if that's the organization that's providing behavioral health services, we're actually going to bring we're going to bring physical health services in there. So you don't just get your mental health there, but you get your visit, your clinical, well visit there. And so those are the innovations that a lot of times, as Black people, we just very creative. So a lot of times, those are the innovations that we have to create in terms of access and utilization. And the last thing is, okay, I know like these are the issues around in my environment that are keeping me from it. Okay, I'm able to overcome. There's an access and utilization issue. Okay, I'm able to overcome. Now, once I get into the healthcare facility, then you have that third layer, that interpersonal medical racism, that bedside racism, right? Where you're not getting the high quality. And that comes really about trying to think about who can be our advocate, one, and you see that with doulas and having that kind of additional advocate. But number two, it also comes from both training for staff on the inside, as well as making sure that, I like to say to my patients, I want you to be protected and ready. So that means having your notebook of questions. That means knowing what informed consent looks like, and you need to know benefits, you need to know harms, risks if I don't do anything, what is going to be the potential consequence. You need to be able to come in and also be able to say who's on my team, who's supposed to do what, and know who those people are. These are things that, unfortunately, a lot of us, I know because of kind of my background, but a lot of us in the general population don't. And so those are the places where there needs to be much more inspired, information gathering and information dissemination, so that we all are kind of making sure that Black and brown people are on the same level in terms of getting the care and advocating and demanding for high quality care.
Now, speaking of advocacy, because I know with your Melanin and Medicine overall company, you push advocacy for physicians and also patients as well too. So, how can we advocate more for physicians starting off first, and then also just patients or Black women overall working in high stress environments or in STEM or just in the work space overall, where we're like the only Black person, where we're constantly in the fight or flight, type of situation? How can we advocate for each other and make our experience better so our overall health can be better?
Yeah, and so Melanin and Medicine really was this space where I felt like there are 4 levels of missing pieces within many of our workplaces. First, the vulnerability and the network, right? That we don't have a space where we can just be like, I'm myself, right? I like Biggie, I like medicine, like I like all of these things and I'm trying to kind of, put a certain, because this is what I'm told I'm supposed to be like because I'm a doctor, and because I'm a Black doctor, I got to make sure it's on 100, that I'm extremely professional, quote, whatever that means, extremely, articulate, whatever that means. And I think one of the things is not having a space where we can literally close the stress response cycle and just be ourselves and be authentic. So I created Melanin and Medicine for physicians to be able to have that space, Black women physicians to have that space, because we spend the majority of our time in our workplaces. And if you can think about the majority of your time you are spending not being able to be yourself, that's stressful. And that is right. That is very stressful. I think the other piece that is really important for Black women physicians is understanding kind of, we have this unique space where we have to be still the same Black woman, right? Who holds it down for her family, her sisters, brothers, parents, all of that. But then we also have our communities and our patients, and we have to kind of be that pillar for this increased ecosystem. And that when you don't have the ability to pour in when you're giving out so much, that's problematic as well. And lastly, I think one of the other issues is lack of sponsorship and mentorship. When there's isolation and as we move up through the pipeline, we see less and less of us. If we don't have strategies to identify who are the people who are guides and peers to kind of like help us through that salary that they told you, that's not, no, go negotiate for more. Not like, and or this is how you got to handle that conversation. Without those guides, we do ourselves a disservice, and sometimes it's hard to find them because, like you said, we're not everywhere. And so really making sure that we have a way to facilitate connection, and also organizations being able to do that. So funding these kind of spaces, making sure that they prioritize mentorship and sponsorship and connection of those people for Black and Brown women is extremely important, and a lot of the work that we're doing in Melanin and Medicine. And so my goal is that if Black women physicians are able to channel in and do that for themselves, they're able to advocate. And when you come in for a visit, they're asking different questions, and they're like, who's your mentor? What is going on with you? How are you taking care of yourself? Because they now are conditioned to do that. And now they want to protect and empower you to do the same.
I feel like what you're doing is great and wonderful because, just in the minimal sense of things, you can't really help someone when you're stressed out and overwork yourself. So I think this is great for women, like physicians, like Black women physicians overall, just to, ease the burden of just every day being Black in a white dominated workspace. Like, I'm not a physician, but I definitely work in a white male dominated space in STEM. And it is so draining sometimes. When I first, went from HBCU lifestyle to working in a white male dominated workspace, I literally felt like I lost myself because I could not really openly express who I am, constantly code switching, constantly worried about if I said something wrong or if they took something I said the wrong way, and just like the microaggressions and the covert and overt racism, I went through it all. And I realized how much, stress and draining it was on my mental and physical health. Like
and that's why I say, my work, it's interesting because we've expanded, right? Although my support services and our in-person services and virtual services are for Black women physicians, we had to do something because I was hearing from all sorts of women professors and, people all over who were like, what about us? And so we were able to finally pull out some services, some of the programs that we had. One was Own Your Power. And it's like this boot camp, and it's really about like letting go of what other people think, letting go of uncertainty, letting go of negative self-talk, of perfectionism, all these things that kind of keep us like. And so I was like, all of my clients were like, you need to pull that out and just like get that, like put that out for people to be able to get that. Because, and that's what we've done now. We created Melanin and Medicine University. And so we have our Changemakers Academy course and our Own Your Power course. And these are courses that we're just like, here, you guys, I know we can't like work directly together, but these are kind of video courses that with workbooks that can like really help you. And even if you're not a physician, just if you're a Black woman who is like tired of like normalizing struggle and sacrifice.
Yes. When you was explaining some of the stuff, I'm like, yeah, because honestly, I've been at home working from home because I have a broken ankle, and honestly, I feel so rejuvenated not having to be in the workspace and having to code switch and having to do the small talk. Like, I don't even want to get into it.
I know. And I would say for your listeners, the one thing that, I left my workplace and became full-time entrepreneur in December of last year. But I think one of the things that was really important is having that other space, that other community of people who you can really pour into. And so every woman I talk to, I'm just trying to find out where's the regular community that has shared experiences, whether that be professionally shared experiences as a mother, or shared experiences as a, you know, single Black woman, whatever that is. Who is that community that you can release and connect with, and, you know, and network with, and just kind of like, because that can be enough. If you're doing that regularly, you look forward to that monthly thing, and you're like, okay, well, I'm a, you know, right now, but I have the end of the month for that meeting. So it's really about doing the work of trying to find those communities, and asking people. And I think a lot of times we do the strong Black woman thing, right? We're emotionally exhausted, but we have to look emotionally suppressed and not show any emotion. We care give to our own self-detriment, and then we have to look super independent as well. And when we're not asking for help, we don't get help.
Yeah, I definitely agree. Like, I even got to a point where I tell people, like, I'm not as strong as you think. Like, I'm not this super strong Black woman, okay? I have issues. I'm a human. Like, I go through things. Some days are better than others. Like, I can't just bear all this trauma by myself and not speak about it. And I think that's something that Black women really need to start pushing. Like, it's okay to express yourself. It's okay to seek help. It's okay to get mental and physical help. Like, yeah, that's
And I think Deja, one of the key pieces, at least in the work that I've been doing, has been, you know, a lot of the women who we work with is around pivoting and finding whatever that method, as well as for financial freedom. This is very intersected with you feeling like you have a pathway towards, you know, being financially free. Because if you're not, that job owns how you feel and owns, like, you know, then I can't do anything that jeopardizes. So I am going to, you know, act exactly how they want me to act, so I don't lose my job. And I think if we're starting to teach and learn on our own more financial literacy about different incomes, real estate, and making that extremely important, because I think a lot of us as Black people have been trained, not educated, but trained to be employees and trained to follow instructions.
yes. I wholeheartedly agree. It's like you're hitting the point one, two, three. I'm like, yes, you everything. Like, I just had this conversation with a friend, and it was like, I'm so tired of, spending all this time and effort on making someone else rich, where I can put all this time and effort on progressing myself. And the fact, like you said, I don't want to sit here 10, 20, 30 years from now realizing that my livelihood is determined by if somebody likes me or not.
Yes.
That's a scary feeling to me. Like, I don't want my livelihood to be determined on whether somebody likes me.
Correct.
Like, no, absolutely not.
Correct. And we have so much that I do this workshop called Pivot into Your Purpose. And when I'm doing it with the women, and then they're uncovering kind of what's aligned with my strengths, my values, you know, what is it that I am passionate about? What am I talented at? When we start to bring those together and start to realize what gifts they've been kind of just sitting on and thinking that, well, this is all I can do. When we look at that, we're like, okay, let's get to work. Like, let's put this into how can this actually bring some additional income and start to build into something, right? That you can truly feel like, hey, I'm leaving a legacy of something that I created. And it's not hard. I told myself so often that I'm not an entrepreneur. I can't do that. I'm good with my salary, okay? But it wasn't until my health, and I realized when I went to try and say, hey, can I, adjust my job so that it can not drain me? And it was kind of like, maybe not. That's not gonna work right now. And I was like, wait, so I was told to de-stress so that I don't end up not being able to walk. And now I'm going to the job and trying to figure out how a model that I can de-stress, and they're not allowing that. And so this job could potentially determine my health and how I show up for my kids. And it was a done deal. I was like, I'm gonna figure out something. I'm gonna figure out something that is going to make me not have to be dependent on a job. And even if I have to work a bit harder for those first to build that thing up, to know that I'm in control of my schedule, my money, and my time is priceless. And it's been difficult. Entrepreneurship ain't for the faint-hearted.
Not for the weak.
Not for the weak. Not for the weak. It's like a whole, personal development course like in here. But I think I wanted to bring it up because I think it's really important. I think it's easy to say, yes, you got to stand up for yourself. But there are real issues and real consequences for us as Black women. And unless we have created a foundation where, like, if we stand up for ourselves and have a negative consequence, we're okay, then it becomes difficult to do that.
Right. Yeah, you become complicit to trauma.
Yeah.
That's your only financial gain.
Mm-hmm.
And yeah, like I said, I'm, working corporate America right now, but yeah, it's definitely not my end goal. I don't want to be there 20, 30, 40 years just relying on that. And I think a lot of just overall millennials are starting to, and Gen Z too, starting to get out of the mindset that, we have to work somewhere until we retire and then have 10, 11, 15 years left of enjoying our lives. Absolutely not.
Put it that way. Well, and Gen Alpha is right along with you. I have a 9 and a 6-year-old, and they don't want nothing to do with any of the stuff that their mom does in terms of being a doctor, being this. All they can talk about is business and all of these things. So the little ones, they're also kind of getting acclimated to that kind of mindset as well.
I love that. I love it. Now, going into your entrepreneurship ventures, let's talk about Melanin and Medicine now. So can you explain to the listeners what is it overall as a company, and also explain your podcast as well too?
Yeah, so Melanin and Medicine is a company. It is specifically focused on ensuring the wellness and support of Black women physicians and helping them to stop normalizing struggle and self-sacrifice, stop settling for the status quo, and now pivot their lives into their purpose, achieve their vision, and build that impact that they've always wanted, but leave a legacy, right? And I think that the goal of this work is really for women to first identify what is it that I need to unlearn and eliminate. That's our work initially. And then we work on kind of streamlining what we have and starting to rediscover what our purpose and what the thing that we were built and meant to do here on this earth is. And then we give strategy and support, of course, through a community, but strategy on, okay, what are the steps and accountability? Let's make this happen and make that dream that you've had actually real. So it's really a support network. We have an online community for Black women physicians that is virtual off of social media. We also do monthly Sunday socials, which are basically outside of our paid services, but really services that are more kind of like networking and mini workshops to help women. But in our paid community, that really is a space of we get to work with women. They have access to a whole on-demand array of courses, as well as connection points, interactive learning sessions, masterclasses, book clubs. We do weekly and monthly planning so that they basically, our goal is to really give you everything that you need, including an accountability advisor, but everything that you need to say, this is my goal and this is what I want life to look like. And we're going to hold your feet to the fire and make sure it actually happens. The podcast actually preceded the business. The podcast was more an outgrowth of while I was on medical leave. I have multiple sclerosis. And while I presented, I wasn't able to walk. That was how I presented. Over the course of a week, I lost the ability to my right side of my body just decided it's tapping out. And I was like, what's going on? And after my hospitalization, I had to get off of work for 3.5 months for physical therapy to relearn how to walk. And they took my work and gave it to 5 people. And when I recognized what was happening, I said, how many women are kind of on this pathway? And I started a Facebook group. And then a lot of the women in the Facebook group were like, we have friends, but they're not on Facebook. And so someone told me, why don't you do a podcast? And that was how I did the start of the podcast. And so there was no interest in business at all until women who were listening to the podcast were like, can I work with you? And initially I was like, no, I'm a pediatrician. I don't understand what you mean. And then suddenly it really started to say, wow, okay, these things, like, people really need them and want to get that support. And so we initially started with just left classes and courses, and then we realized people want an ongoing community that they can always sit in. And so that's been the work. And so Melanin and Medicine podcast is really about helping Black women in medicine. But look, I've had Asian men call me and being like, I love your episodes. I've had people from all walks of life, but it's really about personal and professional development and growth, and just learning to step into who you're supposed to be. And we have guests, and we try to have guests that show kind of the epitome of doing that and what that looks like.
Awesome. Now, where can we access the podcast and also learn more about Melanin and Medicine?
Yeah, so I would say everything's on Instagram. So my Instagram handle is Melanin and Medicine. Melanin Medicine Co. So Melanin and then Medicine and then CO. And then also I have a website. It's melaninandmedicine.co/resources. But if you go to our Instagram, you'll see all of the links right there, ready for everything. So yeah, you can see our courses. You can see our we have a quiz, and it gives a bonus action guide. We have ebooks. And we also have a discovery call where people can, if they are physicians and want services, then we can also support that as well.
Great. And I will also make sure to add all the links to the podcast, the website, in my show notes as well too, for my listeners to access and learn more about Melanin and Medicine. But now going into my last call segment. And so this segment is where I give my guests last parting words, or last words, or recommendation that they want to give to the listeners. So what is your last call?
Yeah, my last call is, don't forget to put yourself first. And why I say that is because, not in a selfish way, but because of the philosophy of Ubuntu. Some of people aren't as familiar with it, but I am, because we are. And so when you're not pouring into yourself, you're doing a disservice to all of the communities and the loved ones and the people who rely on you. And a lot of times we're looking at it differently and pouring into everyone else. And so I usually say, put yourself first so you can fill that cup and then pour from the overflow.
Definitely. Oh, I'm sorry. Definitely. I was trying to say two words in one time. I don't know why. But thank you so much, though, for coming on the show to bring your insight about overall medicine from a professional. I think that's something that we also need to coin, because a lot of people, we search on the internet, we talk to people about different experiences on things we should do, but it's great to actually hear from a professional in the industry, just overall your opinion about things. So thank you so much for coming on the Shot of Facts.
Thank you so much, Deja. This was amazing. You're amazing, and I'm really excited about what you're doing. So thank you.
Thank you. Thank you. And again, guys, if you want to learn more about Melanin and Medicine, I will add everything in the show notes. But again, thank you guys for listening to A Shot of Facts. Please make sure to like, rate, review, subscribe, tell a friend about Melanin and Medicine and A Shot of Facts. And I will see you guys later. Peace.